Hi, good afternoon. I'm Dr. Tiong Yinn. I'm one of the children doctor from Hospital Sibu. So first and foremost, I would like to thank Pustaka Sibu Sarawak for giving me this chance to deliver this talk. So basically, this talk is about pertussis. Okay, I will mainly talk about the symptoms and how to prevent it. And of course, I will also touch on the investigation and also the treatment of pertussis. Okay, so in Malay we call it as Batuk Kokol. Okay, Batuk Kokol. You might never heard about pertussis, but it is quite important. Pay attention on this disease because it is actually a preventable disease. Okay, there's some measurements that we can prevent it. I will talk about it more after this. Okay. So, what is pertussis? What do you know about pertussis? And do you ever heard about it, or is any other family members has been affected by pertussis before? It is also called whooping cough or 100 days cough. Okay, whooping cough or 100 days cough. So by the name itself, 100 days cough, you can imagine how prolonged is the cough. Okay, sometimes it could be more than 100 days, and it could be a very serious problem. Okay, so pertussis is actually an infection of the lungs and your breathing tubes, and it is caused by the bacteria. Bacteria is what we call as a germ. The name of bacteria is the Bordetella pertussis. Okay, Bordetella pertussis. So you might heard about virus. COVID-19, influenza, they're all virus. Okay, some of you might heard about RSV virus. Okay, of course, the infection can be caused by virus, bacteria, or even fungus. So pertussis is one kind of bacteria. Okay, it's a bacteria. So for the transmissions, it is actually spread by the droplets. So these droplets is usually produced if the infected persons cough or sneeze. Okay. Usually it's very easy to spread to other people's surround to the infected person. Okay. Especially that those live inside a confined rooms or in the same household, it is very easily to spread from one to another. Okay, and it is very contagious, spread easily, and sometimes it can cause very serious problems. I will talk to you about later. There's a lot of complications in pertussis. Okay, so when an infected person sneeze or cough, the droplet will be inhaled by the surrounded people, and these bacteria will stay inside your breathing passage. It will go down to your breathing tube and go to your lungs and cause infections, what we call as the pneumonia. Pneumonia is actually an infection of your lungs. Okay. So this is your breathing tube, and this is your lungs. You can see the pertussis. It stays inside your breathing tube, inside your breathing passage, and inside your lungs, and causing a serious problem, causing an infection. Okay. So this is what Bordetella pertussis looks like microscopically. It's very tiny, very small, but you cannot ignore the complications, the outcome that caused by this kind of bacteria. Okay. So just now I've already mentioned, it's highly contagious. So one infected person can cause 17 new cases in unprotected populations. What do I mean by unprotected populations? So after that, I will talk about immunizations and vaccines. Okay, it's quite very important for us to follow our national immunization program because pertussis is one of the diseases that can be prevented by vaccine. Okay, so I've already mentioned for the pertussis, it spreads through the cough, sneeze, spread by the droplets. Okay, so up to 75% of the cases in the infants are a result of family contact. Okay, if you are living under the same household, under the same room, and the room is very confined, poor ventilations, so the bacteria can be spread easily amongst one and another, especially the babies, the infant, less than 1 year old. Okay, sometimes for less than 6 months old, you will see a lot of complications, and this kind of babies, they need hospitalizations. Okay, they need to be admitted to hospital and for a proper treatment and management. Okay, so who is at high risk to be affected by pertussis? Okay, first of all, of course, the babies I've already mentioned, especially those less than 6 months old, they're quite dangerous. And also the pregnant woman, the close contact, if you are living inside the same household, inside the same room, okay? If you have a face-to-face contact about 1 meter, more than 1 hour, okay? 1 meter, more than 1 hours inside a confined room, you are easily get infected by the pertussis. Okay, so of course, when you have a very poor immunity, if you have a weakened immune system, you are also easily infected by the pertussis. Okay, and of course, the elderly, the elderly, they have some chronic disease like diabetes mellitus, hypertension, and any other chronic lung disease. They are also easily get infected by pertussis. Okay, so what is waning immunity? So we all know that some of our vaccines, immunizations, can be complete when during our childhood. Okay, after we grow older into our teenage or adult, our antibody, our immunity start to wane. Okay, start to become less. So those kind of people also easily get infected by pertussis. Okay, if you have a close contact with the patients. Okay, I want to emphasize again, if you have a close contact with the patients, okay, there's a face-to-face contact about 1 meter or more than 1 hour, then you are easily get affected. Okay, so what are the symptoms of pertussis? Okay, there's quite a numbers of symptoms that you need to know. Of course, the main symptom is cough, batuk yang sangat lama. Okay, just now I've mentioned the other names of the pertussis is actually 100 days cough. So how long is the cough? There's three stages in pertussis. The first one is catarrhal stage. Catarrhal stage, I have already mentioned, catarrhal stage is highly contagious. Okay, during these stages, it can easily spread the disease. It is usually lasted 1 to 2 weeks. You can see how long is it? Lasted 1 to 2 weeks. Then after that, after the catarrhal stage, it progresses into the paroxysmal stage. It is usually lasts 2 to 8 weeks. Paroxysmal stage, 2 to 8 weeks. The final stage will be convalescent stage. It is usually lasts several weeks to months. Okay. You can see how serious is this disease. Okay, so the persistent cough, the prolonged cough can usually affect our daily living. For the children, then they cannot go to the school. For the adults, sometimes it will affect their job. They cannot complete their tasks because of the symptoms, because of the discomfort, because of the fever. Sometimes they lost appetite, especially the infant. They have vomiting. They cannot unable to tolerate the milk or the fruits. Okay. So these are the symptoms of pertussis. Okay, just now I mentioned there are three stages. Number 1, 2, and 3. Number 1 is the carceral stage. Number 2 is the paroxysmal stage, and the number 3 is the convalescent stage. So at first, your baby or your child might have a runny nose, sore throat, and low-grade fever. Okay, quite often the fever is low grade, and rarely the fever can be very high grade. Okay, so after about a week or 1 to 2 weeks, start to have some cough. So this kind of cough is like the bout of cough that can be last for a few minutes, usually worsen at night. So sometimes your baby can make a whoop sound. So it is actually a gasp of breath between the coughs. So that is why pertussis is also called whooping cough. Whooping cough. Okay, because there is one typical uh, gasping sound that you will notice from pertussis. Usually, it is in between the cough, in between the cough. So your baby may have difficulty in breathing after the coughing bout. So why do we use this term, the bout? Because the cough it is a prolonged bout of cough, persistent cough that can last few minutes. Okay. Sometimes the baby might turn blue. Okay, the face was turning blue or gray color, especially in the infant younger than 6 months old. Okay. So sometimes they will bring out some thick mucus. They will have vomiting after the feeding, after the cough. They will have vomiting. They vomit out all the milk that they have just taken. And they can become very red in the face also. Okay, cough until the face turning blue or red. Okay. So as I mentioned before, the cough can be last several weeks or months. Sometimes can be last months. So you can see quite disturbing and quite uncomfortable for the baby, especially the baby. Okay. So stage 3 will be the improvement stage. Okay. But this improvement stage, it is also last for long. Can last for months also. But the cough is less frequent and less severe. Okay. And it starts to improve. So this is actually the timelines for whooping cough, stage 1, stage 2, and stage 3. So stage 1, and as it is very highly contagious, your child, your baby could have a runny nose, okay, low-grade fever, some cough, minimal cough. Stage 2, the cough becomes worsen, becomes very serious and disturbing. Your baby might have vomiting and looks very weak, fatigue, or is as fatigue, and lethargy as well. Okay, stage 3 will be a slow recovery phase. It also take a very long time. Okay, of course the symptoms will be lessened, and your child is getting better and better day by day. So you can see how disturbing is the cough. The face can turn red, can turn blue, and parents, especially the mother, will be very worried and bring the baby to the hospital. Quite oftenly, in hospital, we can see cases of pertussis. Okay, so the mother will describe the cough as batuk sampai biru, muka biru, ataupun batuk sampai muka merah. Batuk yang sangat lama. Ada sedikit demam, baby saya tidak mau minum, tak mau makan. Of course, sometimes you will notice some chest retraction. So what is chest retraction? So you can see here. Okay. Quite often the mother will say, saya nampak anak saya nafas laju, ada sedikit tenggelam, perut. They are quite often mentioned the perut. It is actually a chest retraction. We call it as a chest resection as well. It is signified that your baby is having fast breathing or respiratory difficulties. Okay, so this is the time you need to bring your baby to hospital as soon as possible because we need to start the treatment very soon. Okay. So this is what chest retraction looks like. You see? Can you see the longgang here? Tenggelam, there's a longgang here, and your baby is having a fast breathing, nafas dia laju sangat, tidak macam yang biasa. Saya boleh tengok perut dia, macam ada kembang sikit. Some of the parents will describe like this. Okay. So, what are the complications of pertussis? So, pertussis can be very dangerous, as I mentioned before. So, these are the main complication of pertussis. Then, of course, there are still many other pertussis that I'm not going to touch on it because it is a very big topic. These kind of complications, it usually happens in babies under 6 months old, especially in baby under 6 months old. Okay, so number one is the dehydration. What is dehydration? Okay, kurang minum, kurang air. So, because why there's dehydration? It is because your baby refuses to drink. Okay, imagine when you have a bout of cough, when you have a persistent cough, your appetite will be less and you cannot drink. You are too breathless to drink. Nafas sangat laju sampai tak boleh minum susu. Okay. Sometimes the cough can cause vomiting. Batuk sampai muntah. Batuk sampai muntah. Sampai muka jadi biru, muka jadi merah. So you can see how disturbing is this kind of disease. Okay. So number two is the pneumonia. Pneumonia is also one kind of the complications of pertussis. Pneumonia, jangkitan paru-paru, is the infections of your lungs. So sometimes when there's breathing difficulty, some of the baby, they need oxygen support. They're not only needing oxygen support sometimes, but quite often they need some breathing machine support. So I will talk about this later. Apnea is a medical term. It means that there is a temporary stop of breathing, causing the baby to turn blue. Okay, so okay, kadang-kadang kita boleh nampak baby tiba-tiba berhenti nafas. But this stop of breathing is sometimes few seconds. Okay, you'll see some outcome. You'll see the baby face turning blue and the baby is not breathing, not moving. So it's quite worrying. Of course, the parents will be very panicked. They bring the baby straight away to hospital to seek the treatment. Okay, poor weight gain is also one of the complications because imagine your baby, dia tidak mau minum susu langsung, and kencing sudah jadi kurang, kencing jadi lebih kuning, and refuse feeding, reduce in feeding, causing the poor weight gain. Okay. Convulsion, fit, sawan, in Malay, we call it as sawan. Why there is a convulsion in pertussis? It is because your brain doesn't get enough of oxygen. Okay, if you have breathing difficulties, coughing, persistent cough, your brain doesn't get enough oxygen, and it will cause convulsion, fit, and seizures, sawan. Okay, and of course, the most dangerous complication is death. No? But this death is it is actually happens in very severe cases. Okay, we do often see. Okay, so that is why this topic is quite important, and pertussis is one kind of disease that we need to know and we need to prevent it. Okay, so there is a statistic in younger infants, especially those less than 6 months old. Okay, so there's a 68% will have apnea. Apnea. Okay, I've mentioned before, apnea is a life-threatening stop in breathing. It's a temporary stop in breathing for few seconds that causing your baby to turn blue. So quite a high percentage, it's like 68% in the younger infant. And there's 22% they can get pneumonia, okay, jangkitan paru-paru, lung infections. Okay? And there is 2% they will have convulsion, sawan. Okay? It is violent, uncontrolled shaking. Okay? Sometimes it lasted a few seconds or so, but this few seconds it already causing the panic and overwhelming to the parents. They are quite afraid of it and they are quite scared. And 0.6% will have encephalopathy, disease of the brain. It is all caused by the hypoxia. Hypoxia maksudnya kurang oksigen dalam otak, menyebabkan masalah otak, menyebabkan sawan, encephalopathy. We call it as encephalopathy in medical terms. So 1% will die. Of course, we don't want this thing to happen. That's why it is very quite important for us to prevent it. Okay? For adult, as a parents, we need to know how to prevent this kind of disease. Okay. So investigations. What are the tests we perform when your child get admitted to our hospital? Okay. There are several investigations that we do. So one of it will be the blood check. Blood check, ambil darah. From the blood check, we will sometimes will notice there is a increase in the total white blood cell. Okay, sel darah putih. Kita ada sel darah merah, sel darah putih, dengan sel darah kuning. So this cell darah putih helping us to fight against the infection, fight against the bacteria, the virus, and the fungus. So if there's an increase in total white blood cell, it also signifies, it also means that there is an increase in the severity of the disease. Okay, quite often we can see the total white cell goes out to 30, 40. So normally it is around, it is less than 10. Chest X-ray, we'll do the chest X-ray also, because we want to see how bad is the lungs get infected. Okay, so kita boleh nampak yang tempat yang putih-putih, maksudnya ada jangkitan paru daripada chest X-ray. Okay, and of course the third one will be the nasopharyngeal swab. Okay, this kind of swab is similar to the COVID-19. Ambil swab dari hidung. So usually we'll use a stick, take a sample, and then we send to the lab, and then we can, if there is an infection of the pertussis, sometimes we are able to detect the Bordetella pertussis. Okay, so kita masuk satu stick dalam masuk kepada hidung sampai the hujung, your breathing passage. Okay. After that, we get the samples, and we send to the lab, get um, the whether there is any growth of the bacteria. Okay. So the treatment, how do we tackle the disease? What is our weapon? Okay. So first of all, babies who are suffer from pertussis, especially those less than 6 months old, they need admissions and isolation. Okay. So, and even the severe cases, they also need admissions, because once we admit the child, we will have the chance to close monitor the child. As I mentioned before, the complications is quite scary. The apnea, the seizure, sawan, convulsions, the breathing difficulties. It is quite dangerous if we discharge these kind of patients to home. Okay. Of course, isolations. Wearing mask, hand hygiene, cuci tangan dengan betul sangat penting to prevent spreading this disease to other patients, and even to the parents, even to the siblings. Okay, so we really need to pay attention in the isolations, in pertussis. Okay, apart from that, of course, breathing support and sometimes intubasi. If there is a very severe case, breathing difficulty, nafas laju, sampai tidak cukup oxygen, sometimes we might need intubations in this kind of patient. So apart from that, IV fluid or nasogastric tube feeding is also one of the treatment. Okay. IV fluid means that kita bagi air untuk anak kamu. Kalau dia tidak mau minum, kalau dia ada muntah yang berterusan, batuk sampai muntah yang sangat teruk, kalau dia kurang air kencing, tak mau minum, kadang-kadang kita akan masukkan air untuk dia. Okay? So sometimes you also put in the nasogastric tube, and then we give the milk, the feeding through the tube. Okay? And of course, the very important treatment will be the antibiotic. The antibiotic usually will give early. If we give within 7 days of the symptoms onset, usually it will lessen the severity of the pertussis, and it will shorten the durations of the disease itself. Okay, so usually this kind of antibiotic is given about 5 to 14 days. So depends on what type of the antibiotics. So untuk budak yang lebih kecil, ada different antibiotic that we are serving. So sometimes for baby we give for 5 days to be enough. And of course, sometimes 14 days for other age group. Okay. So this is one type of breathing support. Okay, we call it as EVO. Kadang-kadang kalau anak kamu nafas sangat teruk, susah nafas, kadang-kadang kita memerlukan mesin pernafasan ini untuk tolong dia sikit. So we help the babies to reduce the effort of their breathing, because sometimes the breathing difficulties can cause fatigue, cause lethargy. Kadang-kadang mereka bernafas laju sampai mereka letih. Then after that, if the pneumonia is very severe, okay, kalau infeksi jangkitan paru jadi sampai teruk, kadang-kadang anak kamu memerlukan mesin pernafasan to ease to ease the breathing difficulties, to make them more comfortable. Okay. Of course, at the same time, we can also put in the NG tube, the nasogastric tube, for the milk feeding. Okay. So, IV line insertion. Okay, just now I already mentioned. Kadang-kadang kita mau masuk air untuk anak kamu kalau dia tidak langsung tak mau minum, kalau kencing dia kurang. Okay, kalau dia ada muntah, banyak kali muntah yang sampai dia menjadi kering, ataupun kurang air. Okay, so this is a nasogastric tube. So preventions. When you talk about preventions, we need to talk about vaccine. So what is vaccine? Vaccine is actually contain a component or weakened form of the bacteria or virus. Okay, this component or weakened form of the bacteria or virus in the vaccine, it does not cause disease. Okay, bear in mind that it does not cause disease. So some parents, they are very afraid of vaccine because they think that the vaccine can cause disease. So after the vaccine, your child might get some fever, some discomfort, redness over the injection site. But these are all minor symptoms. Okay, within 2 to 3 days, it will resolve by itself. So we are not to worry about vaccine so much. In fact, we need to follow our national immunization program so that we are able to prevent some serious disease, okay, for your children and also for your own self. Okay? So different vaccines can protect against different type of bacteria or virus. So the vaccine can actually teach your body defense system how to protect you against a specific type of bacterial virus. It is also to ensure the full and lasting protections. You will need to get more than one dose of some vaccine. Some of the vaccines we only give 1 to 2 doses, but some of the vaccines we need to give out to 3 to 4 doses. Okay. So vaccine is just like a seatbelt. Okay. The seatbelt can keep you safe if you should get in an accident, and by putting it on, no matter what, you always be prepared for the worst. So the vaccines serve as the same purpose as a seatbelt. Okay, the vaccine can help your body to be prepared for the disease if you should happen to encounter it out in the world. Okay. So you will notice the children doctor always asks is if your vaccination complete. So they are quite pay attention on this because there are more than 20 types of disease that can be prevented by vaccine. Okay. How the vaccine works, I've talked to you about that earlier on. And first of all, the weak or dead bacteria are introduced into the patients by injection. So the white blood cell will be activated and produce the antibody that fight against the disease. Bear in mind that vaccine doesn't cause the disease itself. Okay, you must remember this because some of the parents, they're quite worried and they refuse to get vaccine for their child. So in fact, they are putting more dangerous outcome on their children. Okay. So after that, if the so-called bacteria infect the person, the antibody is already there, and the antibody will gather together to fight against the bacteria. Okay. So your body already has the memory. of how to fight against some specific bacteria if you have a vaccine before. Okay, so when you get infected by the specific bacteria, your disease can be very mild, and sometimes you will have some minor symptoms. Um, and it won't cause a very severe time of the disease. Sometimes can prevent you to get admitted to hospital. It is same as the COVID-19 vaccine. We all afraid about COVID-19, and we all get the vaccine. Okay, we also get a booster. So why don't we let our children complete the national immunization program? Okay, so it is just the same concept. When you have the weapon, you will know how to fight against your enemies in the near futures. You need to get prepared. Of course, you have to train yourself. You have to train your defense system first before you fight against your enemy. Okay. So how do we protect against whooping cough? Okay, vaccine, still vaccine, vaccinations in childhood, in pregnant women, in the adolescent, the adulthood, and in the family members. Okay, it's quite very important. Sometimes it can be quite painful for the babies, but it is only a short moment. Your child will might have some mild fever, some pain, and some redness over the injection site, but it will get better day by day. Sometimes it only lasts 1 to 2 days, 2 to 3 days. So you don't have to worry about that too much for your child from getting the vaccine. Okay, especially the pertussis, you are able to prevent it. So why don't you get it first, and you prevent it, and when you get pertussis, the disease can be very mild, and you won't need hospitalization in the near futures. Okay, as a doctor, we also need to pay attention. We serve as a very important roles to ensure that our patients, especially the children, they all get their pertussis vaccine during the infancy. Okay? So this is our national immunization program. As you can see, there's a 6-in-1 vaccines that include the pertussis. Apart from it, it also includes tetanus, polio, diphtheria. You can see we need 4 doses at 2 months old, 3 months old, 5 months old, and a booster when we are 18 months old. Okay. So it is quite good that our Kementerian Kesehatan Malaysia they have implement this pemberian vaksin kombinasi tetanus, diphtheria, pertussis kepada ibu hamil mulai tahun depan. So you can see how we are protecting our children from getting harm from pertussis, and our effort to prevent it, and we can also see the worldwide countries, how do they prevent their children from getting severe disease. They are really working very hard on this, and I hope every parent you can bring your children, and not only government hospital, even private hospital, they have the extra vaccine also that you will be able to get it from. Okay, so we need to build out the protections. The baby usually needs 3 shots of the pertussis vaccine to build out a high level of protections against the diphtheria, tetanus, and the whooping cough. Okay, so apart from the patient himself, the close contact, the siblings, the parents, those who living under the same roof, we have this post-exposure antibiotic prophylaxis. So especially for all the households and the close contact, and for the infant younger than 1 year old, for the pregnant woman, for the person with a low immunity, the person with underlying chronic disease, it means that when a person who has a prolonged disease, or the person who take care of a small baby, okay, the nanny from nursery, okay. Of course, we advise that these post-exposure antibiotics should be given within 21 days of the symptoms of the patient. So, as I mentioned earlier, vaccine can protect against more than 20 kinds of the disease, including hepatitis B, the mumps, polio, rabies, measles. Okay, so you need to talk to your doctor, your health worker, to ensure that the vaccination is up to date for you and your families. So prevention is better than cure. We all know that. It is time we emphasize on that, and it is time we put more attention and we spread the benefit of the vaccine to our friends, our family members, and of course, we want to protect our child from getting a severe disease, especially pertussis. Okay? So with that, I think this is the end of my talk today. I hope you enjoy and you learn something. Lastly, I still want to stress that prevention is better than cure, especially in pertussis. Okay, thank you once again. Thank you, Pustaka Sibu Sarawak, and thank you all of you. And